Here's Mike Huckabee and Brian Kilmeade saying that tech monopolies should be regulated after removing these California doctors. Now, I will say this. I'm totally for the regulation.
Yeah, 100%.
And if it comes about because they're taking, quacks off of their YouTubes, I'm okay with that. As long as what we're talking about in terms of regulation is not just you need to allow bad medical advice to be broadcast in the course of a pandemic. As long as that's not the regulation, I'm totally down to regulate these guys in such a way that there's a government bureaucrat in every single one of their offices at all times. But here is Mike Huckabee and Brian Kilmeade with really they're talking about this, I think, more as a way of saying like, hey, maybe this coronavirus, maybe we're just imagining it.
These guys are medical doctors. They're scientists. For heaven's sakes, they didn't say anything that was really disputable. They were giving facts, figures. They were invoking some opinion in terms of giving analysis of the facts they presented. I thought the most salient point they made in the course of the video, which I did see before it got pulled, was that historically, when you have a pandemic, you quarantine the sick people, not the healthy people. And that was sort of like, the light bulb went off. The one deep in my stomach that I'd swallowed last week after I washed it down with some Clorox. And again, that was a nonsense thing people accused the president of saying, which he never said. But I think YouTube has to answer for the selective content and the way that they have censored anything that just doesn't fit their own agenda. Something is wrong with that, with Facebook, Twitter, YouTube, and Google.
Unbelievable. I can't underline this enough, how alarming this is. These are doctors that came up with hard number and stats. All they said was, argue with my numbers. I'm not just giving an opinion. Yeah. I'm not spouting out on a soapbox on a vacant LA street corner. I am a doctor. How dare you take down what my facts revealed? Here's Dr. Dan Erickson explaining his reaction to having YouTube act against him.
We had tested about 5,213 at the time of that video, and we had about 340 positive, which is 6.5%. So I was giving them raw data. It was not a biostatistical analysis. It was not peer reviewed, and we didn't say that it was. It was merely raw data because they said, what kind of an outbreak are we having? I think YouTube would realize once we get the economy going, and we get people safely back to work, it will be better for them. And so really the herd immunity is really the main thing. How do we get herd immunity, that 50 to 70% mark where the disease is controlled and we can get back to work?
Governor?
Yeah, most of the people who think we ought to shut everything down are people who are on the government payroll, which means their jobs are secure and they're getting paid. There's 26 million Americans who don't have a job right now because we've shut everything down.
So these doctors are basically making the case that they're saying YouTube should agree with, because more people their medical case is that more people are going to be using, it's going to be better for YouTube. If here is Chris Hayes debunking while essentially Tucker Carlson was promoting these two quacks. Here's Chris Hayes debunking it.
Not because of the wholly unprecedented society-wide shutdown. Well, you are right to ask that question. But Tucker Carlson based his claim in part on arguments from two doctors who own an urgent care center in Bakersfield, California. And they say their research found the coronavirus is basically no worse than the flu. He played a soundbite from one of them. Oh, and here they are last night on a different Trump TV show. Now, of course, most public health experts have dismissed these doctors' findings. According to the University of Washington biologist Dr. Carl Bergstrom, who specializes in infectious disease modeling, quote, they have used methods that are ludicrous to get results that are completely implausible. Two national physicians groups described the doctor's claims as reckless and added this, quote, as owners of local urgent care clinics, it appears these two individuals are releasing biased, non-peer-reviewed data to advance their personal financial interests without regard for the public's health. Their personal financial interests. Get this, even YouTube took down a video interview with these doctors. for violating their community guidelines. And the notion peddled by these doctors and wallpapered all over Trump TV is that this virus is not as deadly as we thought. That is simply not borne out by the evidence.
Okay.
Much of this nation has been locked down.
So the bottom line is they're going on and they're saying, well, we never said it was peer reviewed. But the vast majority of people who are on YouTube, frankly, the vast majority of people, period, in any medium, they don't understand. Like, people don't spend their time making assessments as to what that means. Like, they're not sitting there going like, well, I didn't hear them say it was peer reviewed.
If they came out and did a video and said, we own an urgent care clinic, here are our raw numbers, and this is interesting, check it out, it wouldn't have been pulled, and it wouldn't have gotten a little bit of attention because people are obviously very worried about this, but it wouldn't have become a national propaganda tool.
Right.
So
and of course,
it's like the classic move that when you defend, like, you put out something that's hyperbolic and propagandistic, and then you get called on that, and then you back into safe terrain. That's like always the move, people. Yeah, it's the Mott and Bailey. It's always the move. I mean, look, I am somebody, I do think these platforms need to be heavily regulated or nationalized. I think the direction that YouTube takes, actually, it's a start. But I think whenever you click on, say, Al Jazeera or something, there's a link to a Wikipedia page that will tell you about who owns Al Jazeera and the Qatari government. I think that's also true with NBC and so on. I think that type of thing, I would have no problem. Like, the Majority Report is a supported program through its members that, whatever way. I mean, anybody who has, what did you say? Soros is a George Soros funded, Saul Alinsky tactic driven liberal media tool. But I mean, I think greater transparency, and also, I mean, even that, like, you're right. I mean, that points to a lack of kind of broad scientific understanding. I mean, it would be an interesting opportunity if you even have people, this would take a lot of resources, but that would be fascinating if YouTube started, instead of pulling things, actually having write-ups on, this is a scientific channel or a channel that claims to, give you scientific information. Here's the difference between a peer review versus raw data. I mean, I think greater and greater.
Part of the problem, though, with YouTube is that, the medium, so much easier to digest video than it is to actually spend any time reading. I mean, for instance,
that's right.
AM Quickie, we just moved it on to the backup channel. We've written that in the description for the past 3 or 4 or 5 days, but people still don't read that because it's got to be in the exact same medium.
Right.
So, I mean, I think there are, maybe they could redo their video in such a way that says, like, none of this is scientific, but it is anecdotal. So
yeah. I mean, honestly, look, if they did it in the beginning, they said, here's our raw data and here's an opinion based off of that. It's not peer reviewed. It's not, it flies in the face of this such and such consensus. But again, I think the bigger problem is that until you get a serious relief program in place, there is going to be an audience of people who want to go back to work as quickly as possible for obvious reasons, because they cannot survive without being out there.